invite you to discuss your story or talk to us about your story.
Thank you so much, Dr. Naidoo. Doctors, specialists, fellow healthcare workers, ladies and gentlemen, good evening. I'd like to place on record my sincere thanks and appreciation to Dr. Naidoo for making this evening possible. I must say I'm extremely humbled and honored to be here today to address you on a subject that I'm very passionate about and it's very close to my heart. That is healing with quantum physics. And today we're going to be speaking about a quantum physics approach to multiple autoimmune syndrome. Now by now you've all figured out that I am the case study. Today is not just about this presentation. For me, it's a celebration. It's a celebration of a breakthrough in the protocol for treatment of autoimmune diseases. Now according to my MRI scans, according to the medical textbooks, I should be looking like this. Right now, I should be in a wheelchair, riddled with symptoms, full of despair, and ready to face a life of absolute difficulty. But now when you combine quantum physics with neuroscience, neuroendocrinology, psychoneuroimmunology, and epigenetics, these are all branches of a new science that point the finger at possibility. When we believe in ourselves, we believe in the quantum physics, the quantum field of infinite possibilities. Now, ladies and gents, today in the presentation, it's not something that's going to flow. What I'm going to do is give you the pieces of the puzzle that you have been looking for. And by the end of this evening, if we'll put all pieces of the puzzle together. And once you see the clear picture, if that information doesn't knock your socks off, you must have entered the building bare feet. I just want to say something here. In terms of questions, I invite you to please, let's do the questions at the end, because I want to give you all the pieces of the puzzle before we get to the question stage. Now, had I been given this information 5 years ago when I was diagnosed, it would have spared me a lot of pain, a lot of suffering, a lot of trauma for my family and trauma for myself. And today you have this information at your fingertips. Now today in the world, autoimmune disease has become a worldwide epidemic. Currently, more than 80 autoimmune diseases have an effect on more than 100 million people worldwide. The NIH estimates that 23.5 million Americans are living with the condition, and some of them actually say the figure is as high as 50 million. What's very interesting is that females have a higher susceptibility to autoimmune diseases compared to men. In fact, autoimmune diseases as a group ranks among the leading top 10 causes of death for women in the USA. Ladies and gents, it is a very, very serious problem we have in terms of autoimmune diseases right now. Now, the common triggers to autoimmune disease that is in the medical textbooks is genetics, the environment, the toxins, the intestinal permeability. I'm going to speak a little bit more about that. And what's interesting, they speak about a weakened immune system. I disagree completely. Our immune system is so specialized, it is doing its job. The massive trigger is emotional trauma that we need to add to this, and you will see why. So Dr. Naidoo mentioned some of the conditions that I'm diagnosed with. 5 years ago, all at once it hit me. I just didn't have a second opinion. I got 5 specialists to have a look at me to confirm the diagnosis. It was so serious. I was so riddled with symptoms. The multiple sclerosis, which is a demyelination of axons in our brain, the rheumatoid arthritis, of course, affecting the joints, the Hashimoto's thyroiditis, and then the fibromyalgia come in. Right now, it's the first 3 that's classified as autoimmune. Fibromyalgia is not seen as an autoimmune condition right now. But all 4 of the conditions, unknown cause, and there's no cure. I started off with Dr. Sukur as my neurologist, and I went together with Dr. Mohammed, who looked at the RA, and from there I went to Dr. Bhagwan in Durban. I kept looking because I wanted somebody to tell me, no, it's not that. I was desperate for a doctor to tell me that's not what it is. Professor Modi and Professor Bill also had a look at me, and they all came to the same conclusion. Now, from all the conditions that I mentioned, multiple sclerosis is the most debilitating. So of course, all the focus went to the MS compared to the other conditions. It wasn't even important, as debilitating as that is. And when you look at MS in the USA estimates that they have about 400,000 people living with MS, and there's about 2.5 million people in the entire world that are affected by the disease. Here in South Africa, it is not very well documented. The South African Medical Journal says there must be about 5,000 sufferers. I believe there's probably a lot more. So what exactly is MS? MS is an inflammatory condition. It's demyelinating the axons. It's damaging, where are we? It is damaging the myelin sheaths that's covering the axons. And of course, the nerve cells that need to send out information to the rest of the body. Wherever the damage happens, that part of the brain cannot send the information. There is no communication. So now, depending on where the damage happens, the patient loses that functionality. When the nerve cell is damaged, it forms a scar. It happens at various parts in the brain and spinal cord, and then these scars, we call them, we get the name sclerosis. So they're all over, so multiple sclerosis. The condition is disabling, it is debilitating, and no 2 patients have the same symptoms because the immune system attacks different parts of the body. Now, in terms of where it's attacking the body, where it attacks us in the brain and the spinal cord, the patients will present with different symptoms. Now, there are 4 different types of multiple sclerosis. First, we have the relapsing remitting MS, and this is where the patient has unpredictable attacks and there's a period of remission. What's very interesting with all these graphs, it's disability versus time. So you can see it doesn't matter which MS you are diagnosed with, all of it will finally leave you with disability. All right, so that seems to be inevitable. And then we have primary progressive multiple sclerosis. Here you see a steady increase in disability without attacks. These here, we call them relapses or attacks, and what happens there is that the patient's symptoms get worse, it's exacerbated, or you might get new symptoms with every attack. So in the patients, I was taught what an attack looks like, and when I feel I'm having those symptoms, it's really bad, I need to immediately phone and get into the emergency room. I need to go onto Solumedrol immediately to try and get that immune system down to stop it from attacking me. And then there's secondary progressive MS. Over here, the patient is initially diagnosed with relapsing remitting MS, just like the first one, and then you end up with a complete decline. There is no remission from this point onwards, and that is secondary progressive multiple sclerosis. I was initially diagnosed with relapsing remitting MS. 18 months later, I was diagnosed with secondary progressive multiple sclerosis. You speak to any neurologist out there and he will tell you it is impossible for a patient to go into remission once you are diagnosed with secondary progressive multiple sclerosis. The progressive relapsing MS, this is quite a rare form of the MS, and in this one, you get unbelievable attacks and the disability is very severe and it progresses very quickly. Now in terms of the MS, I was diagnosed from an MRI, then immediately I had a lumbar puncture done where the neurologist looked for oligoclonal bands and they were present in there and the diagnosis was confirmed. This is not my MRI scan, but these lesions are what's picked up in the MRI scans. In my case, Dr. Sakur found that we had close to 30 lesions present in my brain alone. Now, I met a patient, an MS patient, who had just 2 lesions and she was dragging her foot. And my lesions, most of them were concentrated around the cerebellum. And so he told me, Mrs. Naidoo, there's a very good chance you will never walk again. The information going down to your legs is just not getting there. So in terms of posture, balance, coordination, speech, all of that was hampered for me. So it was definitely bad news. So what exactly happens in MS? What are the symptoms of multiple sclerosis?